Hello everyone, we are back with another lecture on the topic violence and sexual abuse, and this lecture is very particular in the subject of forensic nursing. So I am Dr. Jaspender Pratap Singh, assistant professor and head at Shri Mata Vaishno Devi Institute of Medical Excellence, Katara. So here we proceed with our lecture on violence and sexual abuse. So coming to the violence, according to the WHO, violence refers to the intentional use of physical force, power, or threat against oneself, others, or a group that further result in any harm, injury, death, psychological damage, or even maldevelopment or deprivation. Now, not only it don't includes only the physical injury, but also includes psychological harm, maldevelopment, or deprivation. In medical terms, it is act of omission as well as act of commission. This is a broad and more inclusive definition of a violence. This is the classification of violence which is based on World Report on Violence and Health. It can be self-directed, interpersonal, as well as collective. And among the self-directed, there can be suicidal, self-abuse. Among the interpersonal, it can be among the family, among the two partners, or among the community, while the collective is usually social, political, or economic. So coming on the broader or the elaborative aspects of the violence, it can be based on the perpetrator, one who has committed the violence. First one is the self-directed violence. In self-directed violence, it is an intended harm to one's own self. It can be suicide, where there is intentional ending of one's own life. It can be self-abuse, also known as self-harm. In this, there is no suicidal intent. Person inflicts itself with injuries, but without any suicidal intent. Other is the non-fatal suicidal behavior. In this, the suicidal attempts are there, but that do not result in death. Others are the interpersonal violence. It includes among the family member, that is family violence. It can be within the family members, within the two spouse, within the male and the female. Other is the community violence. In this, among the unrelated individuals, typically outside the family. It can be in school or anywhere in the neighborhood. Others are the collective violence. It can be mob violence, which is very common these days, where the spontaneous or planned violence by a group of individuals. Other is the political group violence. It is mainly the politically motivated, where act of violence by or against any political groups, often during the unrest or the protest. Now, the other type is the based on the nature of the violence. It includes physical violence, in which there is use of physical force which leads to any injury or disability. Various examples can be the mechanical assault, beating which leads to the injuries, or there is use of weapon. In physical violence, there are intentional bodily injuries found over the body. Other is the sexual violence. It is just forcing someone into sexual act without any consent. And these include rape, sexual assault, or even the sexual harassments. It can be non-consensual act, which can be contact offenses, or can be non-contact offenses, which include like exhibitionism, sexual harassment, forced, pornography. Other is the psychological violence. Now psychological violence, it includes emotional abuse, and it is intentional conduct that seriously impairs another person's psychological integrity through the coercion or threats. It leads to fear, mental distress, loss of self-esteem. It not only affects individuals' mental health, but also their social network, also deprives them of opportunities for future personal, social, and economical development. Other is the neglect or deprivation. It is the failure of the parent or other person with responsibility to provide the needed of food, clothing, shelter, medical care, or supervision to degree that individual health, safety, and well-being are threatened with harm. This neglect can be intentional or non-intentional. Next comes the interpersonal violence. It can be gender based violence, it can be family violence, or it can be domestic violence. Among the gender based violence, it is among the two genders, one gender is targeting the other. There is usually disproportionately, it affects women as well as the girls, basically like the violence against the women. Now, gender-based violence includes those occurring within a family, such as female genital mutilation, honor killings, dowry-related violence, or even the forced prostitution. Among the family violence, it can also be named as domestic violence, where the family and the domestic violence, it represents the use of force, threats, or any other form of force sufficient to injure or endanger the victim. It can be committed by one family member against the other, or can be the group of family members against the one person. It can among the intimate relationship like between the spouses, it can be against the between the siblings, it can be against a particular child. Thus it is very common problem in India, and victim may suffer from physical, psychological, as well as the emotional abuse. Next comes the domestic violence. Now domestic violence, it has very broad aspect of domestic violence, and in India it takes place inside the home and is characterized by the physical abuse, verbal abuse, even economic as well as social abuse of the family member. The family members are mostly the females in case of India. Now physical and sexual violence has already been described before. The economic abuse is making or attempting to make a victim financially dependent on the abuser, like preventing or forbidding the intimate partner from working or gaining education, controlling their financial resources. Other can be the psychological abuse, which includes threats, harms, isolation. Now, the domestic violence, it can be better understood as a chronic syndrome characterized by not only the episodes of physical violence but also by emotional as well as the psychological abuse by the perpetrator. Now, the types of domestic violence, it can be the intimate partner violence, where the abuse or aggression by a current or a former partner. It includes all form of violence such as physical, emotional, sexual abuse, as well as controlling their behavior. The other can be the child abuse, in which the child is physically, emotionally, or sexually harmed. The child is maltreated and leads to the maldevelopment or deprivation of the child health. The various things included are the neglect, exploitation, psychological manipulation, right? So the others can be the elder abuse. The extremes of ages are included among the domestic violence. First one is the females, second one is the extremes of ages, where one can be a child or one can be the elder ones, because these two are mainly dependent upon the bread earner. So elder abuse, it may be considered as the act of commission or omission. It may be intentional or unintentional that causes harm or distress to the aged person. Now it can be in the form of physical, financial abuse, neglect by the caregivers. Now, the various forms of domestic violence, the various abuses that is included in the domestic violence, it can be the physical abuse, it can be sexual abuse, it can be the psychological abuse, economic abuse, or the overall abuse of the person. Now, what can be the role of forensic nurses in case of violence cases? The major role when the patient reports to the emergency department or in the hospital, the first role and the foremost role of the forensic nurse is a thorough examination. After thorough examination, the documentation of injuries is done. We need to identify the signs of abuse or neglect. And how can we intervene? We can immediately provide them with medical care, the psychological care, ensuring them support as well as the safety. Now, the forensic nurse can collaborate with the law enforcement agencies, with the social work, with the legal teams, that they can act as advocate or advocacy for the victims. Now, documentation is the most important part as a forensic nurse. If they are documenting any kind of history, any kind of physical finding, any statement from the victim, and the most important, if they find any kind of evidence like the description of injury, any evidence, any trace evidence from the site of injury, they can collect and preserve them. Thus, these things will help in proceeding or preparing a report for a legal proceeding. Now, what can be the challenges in addressing such violence? Usually, the victim is reluctant due to any kind of fear or the stigma from the society. There is lack of awareness or training among our healthcare professionals that we are not able to provide them with proper support. Insufficient resources for the victim support. Now, there can be unavailability of the resources like many things. Now, others can be the cultural or the societal norms that normalizes the violence. I must tell you that no kind of violence is acceptable in this society. We must need to be courageous enough to speak out regarding the violence, to report such acts of violence to the investigating agencies so that a legal proceeding can take place. Now, what can be the preventive measures? What can be the strategies? First one is the education, educating the communities. The primary duty of any healthcare profession is to teach the masses. Thus, educating the communities about those signs, those consequences of violence will help in the preventive measures. Others can be the strengthening laws, like including the stricter penalties and enforcement against the perpetrators. Other is the support system, establishment of the shelter homes, helpline numbers, as well as the counseling services, which are already available in apt amount in this country. training the healthcare professional and equipping the forensic nurses as well as doctors to identify and manage the cases of. Now, another form of very common violence in our country is the sexual violence. Now, as per the WHO definition, any sexual act, attempt to obtain sexual act, unwanted sexual comments or advances, or act of traffic or otherwise directed against a person's sexuality using coercion by any person regardless of their relationship to the victim in any setting, that comes under sexual violence or sexual harassment. Now, these acts qualify as a sexual violence if they are committed against someone who is unable to give consent, who refuse to give consent because of any kind of reason. Maybe it is age, maybe it's disability, maybe due to the misuse of authority, violence, or threats of violence. Now, in India, the sexual assault is, which is another form of sexual violence, it is used synonymously with the rape. Now, as per section 74 BNS, which was previously 354 IPC, it is indecent assault, and this section is exclusively for the females. Now, section 74 BNS, it includes any unwanted sexual behavior or touching of a female without her consent with the intention of knowledge to outrage her modesty. The subsections 75 to 78 BNS, it includes various definitions as well as their punishments. So 75 BNS is sexual harassment, 76 intent to disrobe, 77 voyeurism, and 78 BNS is stalking. Now we will explain all these sections one by one in an other lecture. Among the violence, there is another psychological aspect related to the sexual violence or the sexual assault, that is rape trauma syndrome. These are clusters of psychological and physical symptoms that is experienced by the survivor of rape or the sexual assault survivor. There are three phases. First one is the acute phase, in which the patient is in shock, denial, guilt, as well as there are present the physical injuries. Other is the outward adjustment phase, where there is suppression, there are behavioral changes, and the nightmare in the patient. Among the resolution phase, it is basically regarding the acceptance and the integration of the trauma. Now, here the role of mental health professionals or the forensic nurses is very, very important in maintaining the psychological problem or in solving the psychological issues with the rape or the sexual assault. Now, another sexual harassment of women at workplace, Act 2013, was formed in this respect, and it was formed in 2013, and the formation of internal complaint committee was there at each level of industry. Like in the hospital setting, in any kind of office, there has to be an internal complaint committee. The composition include one of the presiding officers, some members, and also include the external members. External here means someone who is not working in that part, right? So the timeline for complaint, it must be filed or the complaint must be given in writing within the 3 months. So the internal complaint committee, it verifies or inquire and then proceed with some actions against the. Another form of abuse is very common is child abuse. In this, causing or permitting any harmful or offensive contact to the child's body or any communication which humiliates, shames or frightens the child. And this act of omission or commission is done by the parents or the caregivers or the guardians that result in harm to the child. This child abuse can be physical, it can be emotional, it can be sexual, or the neglect, which leads to the maldevelopment or deprivation of the physical abuse. It includes the intentional use of physical force resulting in injuries. There can be the findings you will see in these type of cases. There will be unexplained bruises, there can be fractures or burns, frequent injuries which are inconsistent to the explanations. The injuries can be of different time origin, the fearful or the avoiding behavior of the child, and the same duties as that of other types of violence. The forensic nurse has to perform similar duties like documentation, collecting the evidences, reporting to the law agencies as well as the referee. Thus, coming to another important form of child abuse is the child sexual abuse. In this, the child is involved into the sexual activity in which they cannot comprehend or give consent. It can be in the form of inappropriate touching, it can be the sexual assault or particularly the rape, it can be exposure of child to the pornography. The basic complaints of the child in this can be various kind of phobias. There is sense of isolation among the child. There can be temper tantrums, sleep disturbances. There can be depression or aggression, including anxiety in the child. There can be lack of concentration in his school. Can be the child can be complete absentee from his school, or child can also try to physically harm itself. Self stimulating behavior can be there. So these are the non specific complaints from the child. Now specific complaints, those can be the torn or bloody or stained underclothes of the child, difficulty in walking or sitting. There can be pain, itching or burning sensation in the genital area, recurrent UTI, vaginitis, abdominal pain. There can be infection to throat. These are the general findings in the case of child sexual abuse. There can be the presence of genital injuries along with STDs. Now, the role of forensic nurse is to conduct a proper detailed medical examination, collect each and every important evidence, preserve that evidence, more importantly, document each and everything, maintain the chain of custody, and psychological support for the child. This sums up today's lecture on violence. It is one of the very important both for the academic as well as the practical aspect, especially in the area of forensic nursing. Like, subscribe this channel and keep following for the other lectures of forensic nursing and forensic medicine. Thank you.